Hi. Today we gonna talk about valvular heart diseases. Before getting into valvular heart diseases, I will show you some anatomy pictures to ease the understanding. Valvular heart diseases are mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation, tricuspid stenosis, and tricuspid regurgitation. They are all mostly similar in causes, in symptoms, and investigations, just some difference on cardiac examination. Of course, first you have to know what is the valvular stenosis means. Is the stiffening of heart valves that can narrow the size of the valve opening and restrict blood flow. And you have to know what is the valvular regurgitation means. Is when there a heart valve condition, in which the flaps or cusps of the valves do not close properly, causing a backward flow of blood. Valvular heart diseases causes, or rheumatic fever, that is the commonest in all of them. And collagen diseases is systemic lupus erythematosus and rheumatoid arthritis, and congenital, as Lutembacher's syndrome in mitral stenosis, that means arterial septal defect and mitral stenosis. In conditions when increased blood flow through mitral valve, like in patent ductus arteriosus and mitral regurg, plus papillary muscle dysfunction and mitral valve prolapse in causes of mitral regurgitation. Mitral valve prolapse, also known by Barlow syndrome, that is prolapse of one or both cusps into atrium during systole. Plus the dilatation of aorta, due to hypertension or increased blood flow through aortic valve, this in causes of aortic stenosis and regurgitation. Tricuspid stenosis is usually associated with mitral and aortic stenosis. Tricuspid regurgitation is due to dilatation of tricuspid ring, as a result of right ventricle enlargement. Symptoms of patients are manifestations of pulmonary congestion and hypertension, as dyspnea, and manifestations of right or left-sided heart failure, and manifestations of low cardiac output, like cold hand and weak pulses and peripheral cyanosis, and systemic congestion, and palpitation with the regurgitation, and may stabbing pain with the mitral valve prolapse, angina and syncope in aortic stenosis or regurgitation, and as I said, palpitation with any regurgitation, and may no symptoms if mild cases. On investigations, we do X-ray, ECG, echo, catheterization. On cardiac examination, in mitral stenosis, we find slapping apex but with weak pulses, an apical diastolic thrill, an accentuated S1, and we hear low murmur on apex, increase with expiration and left lateral position, and is mid-diastolic. In mitral regurgitation, we find hyperdynamic apex, and systolic thrill over the apex, an accentuated S2 in case of pulmonary hypertension. And we hear blowing murmur on apex, increase with expiration and left lateral position, and is pansystolic. In aortic stenosis, we find sustained apex, and weak S2, and we hear harsh murmur on second right intercostal space, increase with expiration and leaning forward, and is mid-systolic. In aortic regurgitation, we find as aortic stenosis, plus water hummer pulse, and usually normal S2. In tricuspid stenosis, we find mid-diastolic murmur at lower sternal border, increase with inspiration. In tricuspid regurgitation, we find systolic thrill over tricuspid area, and we hear pansystolic murmur, increase with inspiration. Did you notice, left-sided heart murmur is louder on expiration, and right-sided heart murmur is louder on inspiration? That was all today. Thank you for listening. I hope you learned something. Thanks again and subscribe for more.